Hello.
Hello. Yes, sir.
Morning, ma. Good morning, Vandana.
Good morning, sir. Good morning and welcome to our today's episode. It is a great pleasure to have you here. And yes, something is sorry. Okay. Yes. So, greetings, everyone. It is wonderful to have you here, and welcome to our this episode yes of Oral Pathology Tuesdays. And today is the first episode of the Perspective series. Now, perspectives is important because that's exactly what happens. The strength of humanity is on learning from our predecessors, from others' experiences, and that is what has made us essentially rule the universe. And with that, we have also with us today a great teacher, academician, researcher, dentist. I can really not continue to say everything that Sir has done, but what we have to remember is Sir has been actually, when Sir was probably all of us have been just sitting back and we were waiting and not doing much. Sir was the one person before Corona and before everybody had to go digital. He was the first person to actually start using social platforms to interact. He had his own avatar. We have all seen him as in Chandru Dentistry as the friendly senior who gives everyone advice. We have heard him. I have had the benefit of having him as a co-examiner. And I truly used to look forward to those episodes where he came for exams simply because, I mean, more than the students, I could learn so much. And he never really stopped teaching. For him, teaching was the thing. Even in the middle of exams, you could depend on him to teach students, even the ones who were going through exams, with the idea that, well, they have to learn sometime, and why not now? It's always been great having him. He has a lot of insights, and I think today have the great opportunity. He has kept given us his time to come here and share some of those ideas, some of his experiences with us. And with that, sir, it is a real pleasure to have you here. And thank you for being with us.
Thank you, Vandana. It's really a happy time for me to wake me up from the pandemic sleep. Now,
Yes.
this episode, when you said perspectives, I would just like to first initially say that whatever I'm going to tell now or whatever my views, it is purely personal. It is not, I mean, it is left to you whether you accept it or something. It is just I'm old enough to speak my mind out of arrogance of so many years of experience. I think I can tell what I feel. And the first and the primary thing I would like to say to start with a quote. I have some quotes. You have to know the past to understand the present and what walk ahead to the future. See, this sentence, this quote has a lot of meaning, and it has an application into oral pathology as such. If you are going to focus on oral pathology, you have to know the past. I mean, the past history of the tissue which you are looking into. And then you will understand what it looks like today. And then you plan what you're going to do in the future. In the same way, the profession as such, I should say, I should address this as a first. I thought I will talk as a rise and fall of dentistry. It is not the rise and fall of dentistry. Dentistry will never fall. It is only on the rise. It is only rise and fall of dental education. The system has failed. So I would like to say the importance of oral pathology as a subject. There's another quote which says, as is your pathology, so is your practice. I don't know who said that. I have this quotation even in my clinic. Whether you like or not, subconsciously, every dentist, not necessarily that he should be an oral pathologist or any other specialist or even a general BDS dentist, all of them have knowledge, basic knowledge, and important knowledge regarding oral pathology. Need not necessarily be the microscopic pathology. No clinic has a microscope in the clinic. But subconsciously, every dentist, when he starts examining the patient, all about the lesion which he is seeing come to his mind immediately from the hard disk. It is there. It is stored there. Whether you are a front bench student or a last bench student, every student has some basic knowledge about pathology. And without this, not a single dentist can practice. You become a quack. It is only a quack who can practice without oral pathology, which we see on the roadside. A small example, I would say. Suppose a BDS graduate, an undergraduate starts a clinic and he has to do an extraction. See, he attempts its extraction, uses all the forces, all the techniques, still he is unable to do it. Immediately, the pathology comes into mind. Basic pathology, why it is not giving way, why I am unable to extract. So some pathology comes to his mind, say whether there is a multiple root or whether there is a cementoma, whether there is any fibrosis, something comes to his mind. That is the pathology you need for practice. You don't need to take the tissue and immediately see it under a microscope. That is, of course, it becomes specialization when you graduate yourself as an oral pathologist. So that is something which I would like to say now. One more quote I would like to tell. No one can do everything. See, no dentist can do everything. But everyone can do something. See, this is a wonderful quotation. No one can do. See, now the science is like that. Even taking oral pathology by itself, an oral pathologist cannot do everything. You cannot go into the molecular pathology. You cannot go into the surgical pathology. There are so many branches of now digital pathology. So much is there. But we cannot, no one can do everything. No pathologist, I think, in the world will do everything. Even on the general pathology side, they have specializations. So, but we need to know something about everything. You understand what I'm telling? You may not go into depth into molecular pathology or molecular biology, but we should know something. That is the basic thing which I think we need today. And I would go back to that first quote, which you have to know the past to understand the present. See, way back in 1968, I joined as a BDS student. At that time, the college started in 1953. The teaching school, I think, it's not even college, it was known as a dental wing. At that time, I was 5 years old. So in my 21st year, I joined dentistry. And I would like to say one more funny thing. Profession is the first life partner. I feel it is the life partner. And you have your real life partner after some time, once you are an adult. But this life partner business, I'm just going on the fun side of it, lighter side. If you imagine now marriages are, you have love marriages, arranged marriages, and one more I would like to say, forced marriages. You get forced into it. So dentistry was, my dentistry, it was not love marriage. It was neither a arranged marriage. It was a forced marriage. Because when I applied, it was by accident I applied for the dentistry and I got waitlisted. And then no other go, I was forced into it. Same way, even my post-graduation was, forced marriage only. I was trying to get a better girl like orthodontia or prosthodontics, but I got this wonderful girl, oral pathology. So it is a destiny. But of course, I don't know regrets at all, because that time when I finished, it was the golden era for oral pathology as well as for dentistry. The reason being, lot of colleges started coming. It was actually like first we thought it is a rise, it is a good sign. But when you see today, you find the same thing, it has given a fall. Again, I'm telling, it is not dentistry which has fallen, it is only the quality which has fallen. It is the educational system, number of colleges, number of students, and inadequate staff, on all these things. These have been playing a major role. And one more I want to tell you, in those days, the course was actually 5 years, totally 5 years course. And the first year was basic sciences like physics, chemistry, and biology. First year, one whole year was like that. And from that, it started anatomy, physiology, general pathology, then pathology. And final year, when we came, we had only 4 subjects. And at that time, we had only 2 specialties of masters. One was oral surgery and one was periodontia. There was no other branch. Then slowly the other branches started coming. And I joined my MDS course after 10 years of BDS experience. See, this one point I would like to say, it was mandatory at that time that you cannot do MDS immediately after BDS. You have to have at least minimum of 3 to 5 years of experience. That was very important. Because when I did my course after 10 years of experience, I was almost exposed to every procedure in dentistry. That is in my private practice itself. But today the scene is difficult. It is totally different, that once you enter into the finish your final year, you are immediately seeking for a post-graduation. So once you join a post-graduation, unless you are practicing, if you are not practicing, you will forget the basics, which I'm sorry to say. So that is where today we have failed. And that is the reason now you see the students who graduates who are finishing the BDS, they are able to learn better outside the college than inside the college. I should say it is a blessing for them that there are so many academies which have come forward to teach them, which first I thought it was a wrong sign. But now I feel, what will they do if they don't learn anything in the institute? Now the institutes in themselves have started giving a certificate course, giving this course, that course for just 1 year training. Of course, it's for a price. So the education itself has become very expensive, so that when the student finishes the course, he is just left out without knowing what to do. Of course, there are extremes. There are some dentists who are flying high. I won't say no. But those people who are even flying high, they have an understanding past in them. Either their father is a dentist, or a mother has been a dentist, or there have been parents have been doctor or something like that. But when you come to a fresher, you find it is very difficult. But this was not the state when we passed out, because there was only one college and the intake was almost less than 40 students. And this went on for years till private managements came. That happened a little late, past 20 years, I think. But once these private colleges came, the system changed very much. They removed the rule that you need 3 years of experience. They were able to join post-graduation. And of course, there were initially there were not enough competent teachers. For example, when I graduated, there were no other oral pathologists other than my guide, who was Dr. Vishwanathan. So I was actually grabbed from this college, that college, everywhere. And I thought it was a blessing. But as days changed, as of day to day, I find I sent your link even to Dr. Mandana that globally oral pathologists are not happy. No, not oral pathologists. Pathologists are not happy. There is a, I mean, in the Facebook, I saw that. So what is the reason? See, pathology is probably, I would say, as a subject, I think we have understood it wrongly. Pathology is not, it's only a branch, imagine. It is only a branch of the tree which you call as a dentistry. And the tree can exist without any branch. It can give root to some other thing. So every specialty is considered as a branch, but you have to consider dentistry as a whole. See, I would say, I read an article in our journal where somebody, I don't know who wrote it. I mean, why should we have a separate subject as oral pathology? Of course, it is a science indeed, which needs a lot of input, a lot of intelligence and a knowledge in it. But today's oral pathology, I would say, it is for learning. You learn an art. If you think you want to be a detective, I heard that we use detective. The oral pathology is the subject. You can learn, but remember, as on day, you cannot earn. You may get a lot of stories. You can become a researcher, you can become that, you can become that, but that is a very, very minimal minority. I have seen some of my brightest students, postgraduates, who are standing first in their BDS and in oral pathology also, doing nothing, or they are doing something totally different from what they have learned. So we have not even upgraded our facilities in the institutes for them to enter into research. And how do you expect them to go into research? And here one factor comes back. And especially I used to focus, because nowadays more of students, ladies, girls join dentistry, and even in BDS, oral pathology, I see a lot of girls. But I used to tell them, of course, you need knowledge, you have to earn, you have to study everything, but your main focus is family. See, when you enter into the research and other things, you have to forget the other half. That's what I have seen. I have seen my own colleagues doing PhD and how much struggling they were and all. Well, the final thing what you feel is whether you have enjoyed the education or not. Okay. Now, and one more thing for the youngsters I would like to say. As I told you, I was telling about love marriage and arranged marriage and forced marriage. See, one thing what happens in families, if it's a love marriage, parents start questioning the couple. But you only got that girl or you only got that boy. You are not able to question them back. But in arranged marriage, it is the other way around. The boy or girl blames the parent. You only selected that boy, see what I'm doing now. So the condition is, most of the students who join BDS are under the compulsion of the parents. It is rather a forced marriage. So the consequences you have to see, and if you take it as a life partner, if you take profession as a life partner, of course there is chances of going in for a divorce. You leave the profession and go. But if it's a real life partner, you have to live with it. live with her, whether you like it or not. So some of our profession, like oral pathology or even dentistry, for the matter, whether we like it or not, we have to live because we have to earn a living, isn't it? We have a family, we have our own expenses and other things. But as I told you, the knowledge of pathology is very important for even a graduate practitioner. A general dental practitioner needs knowledge of pathology. So teaching pathology for an undergraduate is very, very important than teaching a postgraduate. See, postgraduates, I normally tell, we don't teach them. We don't teach them. I don't accept that word teach taught. Because teaching ends in BDS. There you teach them because they don't know even a cell. But here, when a BDS graduates join post-graduation, I'm sorry to say, most of them are not treated as an undergraduate. You are trying to start them teaching as a think he doesn't know anything, which is very, very wrong. When he qualifies himself as a bachelor, you know he knows something. He is aware of something. So the curriculum itself, I wish it changes and teaches something more than what you learn in your BDS. See, we read same thing. Schaefer's is in BDS and Schaefer's in MDS also. Of course, we read more other more specialty books like immunology, this thing, digital pathology and special pathology, all those things. It is added to it. It's like an icing. All the specialties are like an icing on the cake. The base is your BDS knowledge. All the other things are beautifying, and of course, that only sells now. You understand? So the knowledge in BDS which we give, which we play, I would be proud to say that an oral pathologist teacher forms a main teacher in the undergraduate. Any specialty for that matter, whether it is orthodontia or whether it is oral surgery or whether it is any prosthetic, anywhere, they need the base of oral anatomy, oral histology, and the oral pathology. See, there is another word which I used, that the complaint of the patient and the clinical picture of any lesion, say for an example, an ulcer, is attributed to the basic changes in the tissues involved. See, this I have put this in my forthcoming book. This is another important thing. The complaint of the patient and the clinical picture of the ulcer or any lesion is attributed to the basic changes in the tissues involved. So a clinician is able to diagnose by just seeing the lesion. If he has enough knowledge, he is able to understand why the lesion looks white. Suppose you say you have a film and you have a light in the mid, a green light. When you on the light, it is going to look green. You understand that? So you immediately know that there is a green light below the film. And if you off the green light, you're going to get the original picture. In the same way, any tissue changes is going to be shown outside for your eyes. And that is the best thing we have in our specialty, because we are able to see the lesions through our eyes. Whereas other pathologies which occur in other organs, you are unable to see. You need a scan, you need CPT scan, you see that, you need so many other investigations before you arrive at the diagnosis. So the clinical diagnosis in our specialty, here I would even include oral diagnosis. That is yet another specialty which is very, very important in dentistry. See, unless you are able to diagnose and suspect a lesion, you will never do any procedure. You are not supposed to do any procedure. Even a plain extraction, I used to tell my students and people who work in my clinic, it may be even a mobile tooth extraction. Make sure what for you're extracting. Make sure what is the pathology behind it. Unless you're satisfied with the pathology, never do the extraction. You must find out whether if it's a single tooth mobility, you know what it is. If you have about 3-4 teeth are mobile, then you know what it is. And without any reason, if the patient says this has been doing for a long time, now I feel there's a swelling, then you suspect something. So every procedure in your, if it's going to be a operative procedure, okay. If you are going to prepare a crown, see, immediately the oral histology and pathology comes to your mind. See, the crown preparation in a 16-year-old boy is very much different from a 60-year-old person. Understand, you are applying your pathology here and you are applying your knowledge of histology here. You know at the 60th year how much of pulp tissue is having, how much of secondary dentine is having. Whereas the 16-year-old person, you know what is the condition of the pulp and other things. So accordingly, finishing the preparation, you will know after the preparation how much of complaint comes from the patient regarding sensitivity, regarding pain, regarding other things. So the knowledge of histology and pathology goes side by side. And as I told you, oral diagnosis and radiology also. See, these are things which were together when we were students. There was no separate, branch like oral pathology or something. It was together. But for convenience sake, these branches started coming out. Yes, it is good. It is very good when a tree branches, and now there are even, on a funny side, I would say, from branches, you have so many twigs from branches. Now, in those days, it was operative surgery, ODS. We used to call it as operative dental surgery, where we used to make cavities and do the filling and all. And in those days, there was no separate endodontics. But now, you see, it is a very good branch of endodontics, which people are doing well, very well at it. And we say, here only I say that there is no downfall of dentistry. Actually, dentistry is in a high rise. Only thing, it is expensive. That, of course, that you cannot help because our gadgets are quite expensive. And what you learn today, what gadget you buy today, it becomes obsolete tomorrow. So the expenditure is more. And likewise, they are able to earn a little more, some of them. But one thing we forget is about our organ of specialty, that is the teeth. Teeth, I would say, a tooth is a wonderful organ, which is unique by its, development. I find there is no other organ in the body which develops within the bone. You understand? It develops within the bone and comes out of the bone. And it is made up of 3 hard tissues with 1 vital tissue, that is the pulp. See, there is no other organ which develops and grows outside. It develops in the intrauterine life itself. So it is a unique organ. God, as nature, has given 32 of it and 20 of it, that even if you lose one, the others will take care. And it is a tissue, it is an organ which is not that easily destroyed as we think. Though globally we have been learning right from day one that there is millions of dollars being spent on caries and periodontal diseases and all those things. I find today, when we are educating, on the one side, we are educating the people to take care of the teeth. We are educating them to brush twice a day. We are educating them to go for biannual dental checkup. So when you are doing this, naturally there will be a decline in the number of patients who really need treatment. That's why we focus on biannual checkup and a routine scaling and polishing which is a wonderful treatment. I think if it's done properly, you will retain your teeth for lifelong. So here I would like to say most of the lectures which I see any pathologist or any medical people, they say, for example, our own topic, the lifelong topic, evergreen topic is oral cancer. You start with the tobacco and finish it with prevention is better than cure. So what is in between these two slides? Nobody knows. Because we end it with prevention is better than cure. Now here I would say before prevention or after prevention, I will say prediction is better than prevention. I would like to add this. Prediction is better than prevention. Say you tell a patient on examination, say you tell, for example, I normally say this, if they have a misplaced premolar, say a lower premolar or upper 8 buccally placed or lower premolar on the lingual side, which is hurting the tongue, I would say prevent the onset of an ulcer by removing it. So I have removed so many wisdom teeth without any complaint. Because if it doesn't erupt, I feel, and some oral surgeons also feel, that the best treatment is removal. Unless it is placed properly and it occludes probably with the upper tooth or lower tooth properly, the jaw size is bigger, then it is different. But otherwise, the prediction is very, very important. Say, suppose you find a person having a habit of, say, tobacco or something initially. So it is not necessary that you should wait till it becomes a submucous membrane or until it becomes a leukoplakia, till it becomes some precancerous lesion. You do not wait. You tell them that you may land into this. That is also the role of a pathologist or a clinician. So prediction is very important. And of course, prevention, that also we are doing very well. We have so many no tobacco clinics, no tobacco programs, whereby we are educating the people. So the education is the most important thing, which, the society's education or the public education. One of my students who returned from UK after about 20 years of clinical practice there, he is now in Hyderabad. He told me, sir, in UK, it is not that we earn not by treating a patient. We actually earn more by giving this annual checkup. There are a number of patients more who come to the clinic for the periodic dental checkup. So this is where the community dentistry should do. This is where the teaching institutions to play a role. Because as an individual, I cannot spend lakhs or crores on it. Because you can see it's in corporates, like the toothpaste companies, how many crores they spend just to make people buy their product. So why don't they focus and spend crores and make those patients come see a dentist? I've seen some advertisements where you visit your dentist twice a year, which you can't even read. But whereas you use my toothpaste, the sensitivity goes within a day. See, this is all giving false hope to the patient. I think we have to break it. So I would like the youngsters to focus more on getting the patient to the clinic. And of course, doing a genuine treatment. That is more important. I haven't seen so many clinics, sorry to say, who don't have an ethical practice. That is coming up now because I have some of my students who work in corporates who tell, sir, they are asking us to do molar RCT for every tooth, which doesn't need at all. This was happening in US back in the year 1975, when some of my own classmates, started practice in US. There, this was the trend, saying that it's a preventive, preventive aspect, they used to do silver filling for all the teeth, all the molars. Whether you need a cavity or not, whether there is cavity or, see, they say it is preventive. See, that is not the way we should also develop practice. Now, there are better ways to preventing caries by application of so many things on the tooth, which you can do it once in 6 months. We can educate the patient, okay, come for this application, and you will retain the patient for years together. The whole family will turn up. So the practice point of view, you should focus. Now, I think I'm diverting something a little away. So this dentistry as such, even the postgraduate says, your entry is not very important. See, entering a oral pathology department or entering a operative department or entering a oral surgery department, that is not important. But what have you gained when you come out? Now, the situation in undergraduate level is, when you come out, you want to learn something more. You want to learn to do an RCT. You want to do a flap surgery. You want to do a good denture. You are not able to do. You are forced to join some course to learn again. How long will you spend on learning? Of course, there is a saying, learning never ends. That doesn't mean that you should go and learn in an institute by paying lakhs. That learning is from experience. That is what it says. Learning never ends. If I've been practicing for 45 years, even today I learned something. Because I've written in my book, every single patient is a different patient. Never consider it as the same patient. And every single extraction is a different extraction. It is not the same. You may be using the same forceps. You may be using the same technique. You may be using the same medicine, everything. But the patient is not the same. There is something which is different from person to person as a patient. He may be a brave patient. He may be a patient who is very much afraid of dentist. See, there the difference comes. Here the pathology helps you. The pathology is not only on the lesion. You're studying the patient as a whole. Because there were doctors when on the medical side, the experienced doctors who, when the patient is coming, walking itself, looking at their gait and looking at their style, they used to prepare a prescription. And the world famous dermatologist, Dr. Tampaya, who's no more, who was our teacher, I'm proud of it. That man used to come for clinics around about 4:30, 5:30 in the morning, they used to say. And in his clinic, private clinic, he had hundreds of patients. He can't spend any time. But he just looks at the lesion and he's able to write the prescription. And he was a top dermatologist. All the dermatologists for him, he's like a god for them. So every profession has its experience, which you gain by experience. And rather, I would say, even the institutes, they are now happy to have youngsters as their teachers. They are not, previously when the starting of the institute colleges were there, we had almost at least one senior person was there who had an ample experience. Even now some colleges they retain some senior staff. But it is not their folly, because the number of colleges outnumber the number of required staff. See, when I graduated as a postgraduate from dental college, there was no other person who was qualified oral pathologist. I was the only person who, till for the next 2 years, because that special, I forgot to say, at that time, post-graduation only for 2 years. And I joined at the bud stage. I was the first student to join and first student to pass out of the Madras University, the MGR University at that time. So it was at the bud stage, nothing more. I never saw any slide apart from HND stain. I never knew anything. But there were stalwarts who were able to take us beyond that. That's what I told. Our teachers were first batch qualified postgraduates. Dr. Vishwanathan he was a first batch person. He could teach us so much. See, and one more thing, if I could say, teachers were not there to teach subject alone. They taught us to become a gentleman. I owe this to my teachers. I'm proud to say this. Not only my college teachers, even my school teachers. I belong to a St. Bede's school, which is the famous school in Chennai. So teachers play a main role. And when we take that as a profession, as a teacher, we should also send out the postgraduates as a good human being. Knowledge apart. Of course, I don't say that they should not gain knowledge. Yes, they should gain knowledge. And the course has become, as it was 2 years then, out of which 1 year was totally for basic sciences, anatomy, physiology, and other things. And it was only 1 year, I should say that I was with pathology. And that was 2 years. The old system was to make ground sections, about 20 ground sections. By the time the year will be over, which I know even till today, I don't know what for it was. I think even today they are doing it. I don't know the present condition. So when I was there in my college once I started post-graduation, I made it a point that a microscope is given to them on the first year itself. Let them get accustomed to it. Whether they see the slide or not, let them. That's the way I thought will help them. But now I don't know what is the condition. So, and the knowledge which I gained those days, only that remains in me. I remember, if you say it is an odontologic tumor, it is only ameloblastoma and it's only follicular. Nothing else comes to my mind. But today you have disease is same, the tumor is same, but WHO plays the role. It gives so many different names. Of course, that is the scientific research they are doing. We can't help it. We have to be abreast of it. But what remains, what a clinician knows, if he suspects a odontologic tumor, immediately it comes to him, yes, it must be an ameloblastoma. Of course, after the histopathology biopsy report, then we give them the report, we say something different, or we focus on some other cell and we give it a name. But for a dental practitioner, he should be able to, knowledge should be there to say whether it is an tumor or whether it is an abscess. See, that's why I used to tell my students, people who work in the clinic, find out the basic thing. Whether if it is a swelling, find out whether it is a painful swelling or a painless swelling. Then you proceed what it could be. So the basic pathology, I should say, it is very important. And when I told about the successful management of any lesion, lies in identifying the cause of the lesion. That is next. When you see the picture, as I told you, a film under a green light is going to appear green. You know there is a green light. But next you say, why that green light is on? So when a lesion appears white, we are taught like that, whether it is a lesion which can be scraped or non-scrapable. Yes. So it is taught in the general practitioner keeps that in mind. He is able to scrape and say, yes, it is non-scrapable, so it must be something more than a ordinary lesion or the chemical burn or something else. So he suspects something and then he refers it to an oral pathologist or a confirmed, necessary person. So the knowledge is, as I told you, first and the foremost thing which I would say is, when you treat a patient, primum non nocere. I think you must have, this term you should have learned somewhere. Primum non nocere. I think it's a Latin, which means first, do no harm. This is one thing which I would like to say, all the practitioners, don't do any harm. See, this is where your pathology plays. See, what you learn in an institute is something different when you start the practice. You don't apply everything what you learn in your when you are a student to the patient when you are practicing. For example, the patient comes to you and he says, "Sir, this tooth is shaking." Yes, he has given you the diagnosis. But as a student, we were about for OP, we used to go about 5 to 6 students with all mouth mirror probe and the torch in one hand and step on the shoulder, all those things for a dental OP. Patient says it is shaking. So our teacher says, so examine the patient. Now all the 6 people, we take the probe and start shaking the tooth. See, that is not what you do in your practice. When he has given you the clue that it is shaking, you know it is shaking. Similarly, when he says, if you touch the tooth, sir, it is painful. Immediately you turn the mouth mirror and start percussing it. He says it is paining. Why do you want to percuss it? So your knowledge should immediately strike the learn what pathology you have learned. Why there is pain when you are percussing? It is not a non-carious tooth or it is a carious tooth. So what do you expect? What has happened? Why there is pain when you percuss? Or why there is pain or sensitivity when the patient says, sir, there is sensitivity when I take cold or hot. Immediately you search for the cause. You know what is the cause. Pathology comes into your mind immediately. Oh, it is sensitive, means that there is some loss of enamel or somewhere there is some problem. So you focus on that. So unless you have the thing in your mind, your eyes cannot see. The knowledge of pathology is always in your mind. Whether you are a BDS or an MDS, whether you are an orthodontist or a prosthodontist or oral surgeon, the knowledge of oral pathology is always there in your mind. Unless it is there in your mind, you cannot see the lesion. See, I used to tell nowadays, many private college students don't have an exposure of having seen an oral cancer patient. I don't know whether I'm true or false, because I had an opportunity to see 10 patients of oral cancer every day when I was working in Cancer Institute. So I'm able to, that picture is there in my mind. But if a new graduate who starts a practice, who has never seen a case of oral cancer, or say even for that case, oral lichen planus or oral leukoplakia, whatever it is, or even submucous fibrosis, if he has not seen during his student learning career, will he be able to see that? Suppose I show you a fruit which you have never seen in the life and I ask you to name it. Will you be able to name it? Whereas when I give 2 apples and ask you to say which is the rotten apple, you are able to say it correctly. You are able to pick up the rotten apple and say, sir, this apple is rotten in this particular region. That is the knowledge which you have gained by your experience. Nobody taught you what is a rotten apple, or you have been taught by your parents or somebody else. When you took a rotten apple and bite, they told you stop, it is rotten. So it's the same way, oral pathology helps you, and oral diagnosis helps you to say what is wrong. You may not say, go into the depth of it. The oral pathology as a specialty goes into it. Of course, when you stain it with a special stain and all those things, then you reach into the diagnosis. That is different. That becomes a specialty. And that also in future, I think it will become a little more sophisticated pathology. Whereas more of stains are coming. And probably I had a dream that there will be a digital pathology, like a gadget which you are using now in Corona period to measure the temperature. Probably you focus the torch on the lesion and you use the diagnosis. It may happen. Whatever we think, it can happen. Because now with our own eyes, we are able to tell, no, you are able to tell it is leukoplakia, experienced person. You are able to tell what is lichen planus. Without even opening the mouth, you know he has submucous fibrosis. So the knowledge given by an oral pathologist to the undergraduate students is very, very important. I don't know what you people are expecting to me say, but that is the fact actually. And one more I would like to say for the youngsters regarding why they are little disheartened about dentistry and practice, and they are going in for working for about 10,000 rupees, a pathetic condition. And I have seen specialists working in corporates for, of course, you can't help it. You have to make an earning. But what I would say is, of course, it is very expensive to start a practice nowadays. But practice, I think you have to be patient. Great things take time. You have to be patient. Because when I started my practice in 1976, immediately after I passed out, I was the only person on my road. And on either side of my road, at this side, I had Dr. D.P. Rajan, King. On the other side, I had one more of my teacher, Dr. P.K. Bhaskar, Dr. Riyas. So many people were there surrounding me. Even at that time, I used to get only 1 or 2 patients a day. But patiently waiting, now I have a decent practice. I won't say it's a very high sophisticated practice. I do have a very decent ethical practice. But at the same time, so many of my own classmates who started their practice in rural areas and towns like Madurai, Tiruchi, and Sivakasi, all of them, they were singled out in their areas. There are only about 2 or 3 dental surgeons, so had very good practice. They actually were enjoying practice. Some people say I had even about 70 patients a day, 80 patients a day. Even today, there are dentists who treat so many patients. So that is not immediately. It is some doctors who post their talents in the Facebook. I see. I mean, it becomes a sort of advertisement, even I should say. But their background is dependent. You have to see their past. His father would have been a dentist, mother would have been a dentist, or both the parents will be a doctor. So that reference is there. But when you are the first person in your family to graduate yourself as a doctor, whether it is BDS or MBBS or whatever it is, you have to patiently wait. This is not a profession which you reap immediately after graduation. No. Medical profession is a lifelong profession. I don't like to use the word profession at all, but of course it has come into force. It's a lifelong service. Even if you are on the deathbed and somebody comes and asks you, what should I take for my pain? You are supposed to sell some tablet and tell some tablet. That was the trend. But now just totally the scene has changed. We don't see a patient without paying the consultation fees first. See, that is the trend which has now come into force. In our days, it was not like that. I had a doctor who used to have a small dumb box where after consultation, you have to put the money and walk out. I don't say we are going to do charity. No. Some people are angry, sir. How can you say that? You have spent so many lakhs for our graduation. Yes. But still, there is some point of humanity should be there in your life. When a patient rushes to you in your clinic, say with a fall, with an injury, or with some bleeding, do you want him to pay the consultation and then enter your clinic? Sorry, I am just, as I told you in the beginning, it is only my views I'm telling. I'm not hurting anybody. So, it is nice to have, and I should say, for none of us, this profession is of choice. As I told you earlier, I don't think very few, it might be the profession of choice. But for me, it was not profession of choice, but no regrets. I really enjoyed my profession, and this profession, as I told, has got me wonderful friends throughout India and sometimes even outside India. Mandana was one such friend whom I met in, I think it was in Brisbane when I went there to present a paper. And as she told, I don't have that many papers and all. My thing is not that much. I talk a lot to the students, but in our days, there were no presentation, there were no PowerPoint, there were no compulsion to publication, nothing was there. We were all trained to treat patients, that's all. We were given ample training. For example, extraction, you take extraction, as a final year student, we used to extract at least minimum of 30 to 40 teeth every day, not every month, every day. And it was totally, no will come near us. They will just watch there what I am doing. If you break, they will watch what next you're doing. Only after you go around 3-4 times, then you ask them, they will come and help you. Of course, they will help you. Finally, they will teach us what it has to be done. But today it is different. I won't say it is. Today it is more on the conservative side. That is good trend. Not that extraction is good. Extraction is not at all good. But to kind of avoid it. At one stage, it goes for extraction. So my humble request for the, I think time is also, I don't know how the time went. Because I thought I should think about it. And I was, when Vandana asked me, I was wondering what I'm going to talk. But now I think I have given you enough insight into the future. And I would end up by saying that, once again, it is not the rise and fall of dentistry. Dentistry will rise. As long as we have teeth, as long as God has given us teeth, dentistry will exist. I mean, it will exist for lifelong. Only the dental education has fallen. I think anybody will accept that. Because as I told you, students have to learn, and it is a blessing. Because previously I thought it was curse. No, it is not a curse. Private education is a blessing now. At least you are able to learn something outside by paying money. See, what you learn in 3 years after post-graduation, you are able to learn that in a year in a certificate course or something like that, which some colleges are offering, of course, for a price. And there are so many private doctors, so you can even learn from a senior person who is willing to teach you, who is willing to, there are many of them like that. Of course, nobody teaches you without anything. You have to pay for it. But at least you had that opportunity. In our days, it was not there. And it was not necessary also. Because we were trained to do anything. I have done even fixed appliances in my days. I have done root canal treatment in my days. Of course, it might not be as good as today. Today, you have so many other graduates. I mean, endodontic things are there, and pieces are there. But in those days, it was not like that. It was not, nothing was available as such. The market was like that because it was only one college and a minimum number of dental surgeons. Nobody was able to sell things. Very rarely we saw a file or a reamer or a brooch or anything. We have been repeatedly using the same instruments, and we were quite successful in most of the cases. I mean, especially in the anteriors, we were able to do. In my practice, I don't know whether I had some intuition. Any RCT in the anterior, I used to do episectomy, and I was 100% sure of success. That has been my way of practice, probably. So after post-graduation, my golden era started, and I was grabbed from college to college. And finally, I served one of the premium colleges, and my salary was about 6-digit, very good. It was wonderful, and I enjoyed it because of the need. It is not that it was my talent or anything. I'm not I should say, I'm not a great scholar or knowledgeable person, but I was the first person, as I told you, as an oral pathologist to come out of the dental college. And I need not necessarily be the best person. I had nothing. Those days, as I told, Totally, we used to have about only 20 slides or something, the whole of the, for such a big college. And there was one technician by name Balram, I think he was no more. If you go and ask them, sir, are we Vishwanath, sir, go and get amyloblastoma site. So I go into the lab and walk and I ask him for amyloblastoma. He just checked up the slide. He just takes it and see like the sir, come on, take this and give it. He was able to check the slide without any microscope. That was his experience. He used to name any slide, he used to take it because it was not labeled. It was not labeled. So the experience counts, and of course, the people who are interested in knowledge, who are interested into research, very well. There is one subject that is only oral pathology, which will lead you to research point of view. And that also research means it is not, research means the researchers are mostly, it is in the basic sciences, you should understand. A cell biologist is a researcher. Because as a pathologist, we cannot go into that. Otherwise, you have to change your area of interest after oral pathology. After finishing your MBS, there are some people who are doing that, some students who are doing abroad, who are studying a cell which is not related to oral pathology, but they are into the research. But now the present generation, if you are joining any post-graduation, plan yourself what you are going to do. Don't regret after joining and after completion. Don't make it a point that I should finish my PhD. Yes, but think what you're going to do after that. If you have the drive of going into research, of allotting 24 hours, that is research. That is actually research. The PhDs nowadays, I don't think it is a real, research is done. No, you cannot be. I see now it has been mandatory. I think PhD is necessary for teachers. When will the teacher do his PhD? When will he do? He will do side by side when he is teaching a student. Will it be successful? Is it justice? When a person who is teaching, who is a HOD, who is a professor, who is going to do a PhD? There is difference, isn't it? If you want to do a PhD, you should join as a whole-time PhD researcher. 24 hours you are supposed to be in the lab. You'll be with the books. That is the sort of research you need, which is lacking in India. Sorry to say that. I don't know the other areas, there may be true research is being done. But here, very few people are doing that sort of work. Research in cancer, they say, but that I came across one person who's really doing it. Doctor, I think he talked a little just a couple of weeks ago, Dr. Tilakaratne from, he is a person who's doing 24 hours, he is in the cancer, oral cancer. He is doing research. Yes, that is the real research. He may hit the target sometime. He may find a solution. It's not necessary, but he's going towards the proper goal. That is research, of course. But what today's trend and post-graduation to make presentations, to have so many publications and all these things, it is done out of compulsion. Research is not done out of compulsion. It is to be done out of love. And that research to be focused towards the help to the humanity. When I was working in Cancer Institute, Dr. Krishnamurthy, who was the main person, or Dr. Shanta, used to tell, whatever research you're doing, finally it should be beneficial to the person. Otherwise, it is not a research. What for you're researching? The benefit should go towards the patient. He should be relieved of the disease. That is actually the research. Now, our research is going towards that. You want to hit the cancer cell. The oncologists are trying it best. There are so many medicines. I'm very, poor in that chemotherapy. But the chemotherapy has reached heights now. So many of my friends whose own children, wife have got breast cancer, they are able to survive because of the best treatment which is available. But we have not yet found the best treatment for oral cancer, except for surgery, because it is a vital space. It is a place on the face. And it is sometimes it is really pity you treat them and finally leave them in the society with a half the face. I have seen. I was very well trained to make obturators, to say, oh, it is out of oral pathology syllabus. But I was trained to do obturators when I was working there. I had one good doctor, Dr. Sebastian, who used to teach me about making of these obturators. And you know how much gratitude those patients have when you give an obturator? You may feel miserable to give that. It will not even stay there properly because there is no support at all. But in spite of it, the patient is so thankful, happy that you have, because he is able to eat something. See, that is where our branch of prosthetics is doing now. There are some very qualified people who have been trained in such prostheses. It's very happy to see that. Previously, it was not there. We were trained. When we were students, we were trained. We used to make artificial eye, artificial nose, ear, and all those things. All this was given, training was given, and we were there. One person who had trained, he was very anxious to teach us, and he used to teach us. But today, this is what the dental profession should learn. That whatever you study or work, it should be applicable to the patient's agony to clear the pain. So I think I'm exceeding the time. Vandana?
Yes, sir. Yes, I'm here.
I think
No,
we
sir,
have.
it's been very interesting.
And I
Something that
thank
you
you.
said, what you said about how we should not forget our roots as being dentistry is really very relevant. You know, I find it interesting. When I was making that recent logo I was making for my Oral Pathology India, the first thing I made was the microscope with Oral Pathology India in the center as being, you know, focused. And my husband, Felix, is always says that you all keep forgetting that you are dentists. So he said, where is dentistry in that? So you have a microscope, you have oral pathology in there, but where is dentistry? How do you differentiate yourself that you are a dentist who's an oral pathologist? So then I spent days and days thinking what to do. And finally, I came up with the mirror and probe next to it to say that we are dentists. and I think it is true. We do forget. We do forget our, you know, the tree that we are branches of. We do sometimes forget that. And it is very important because otherwise we are not able to really focus what we do to relate to the clinical practice of dentistry where it is essentially required. So I think
Yes,
that
yes.
was a very interesting thing you said, sir.
Thank you, Vandana,
Yes.
for giving this opportunity. And I hope all those who have viewed would accept my whatever I have told. And don't forget that it is on my personal view. It is not people may or may not accept it. But what comes to my mind, what I see today, the scene when so many graduates come to my clinic asking for a job, and I am unable to give them a decent job. See, it is a really pathetic condition. And I have seen so many other seniors also saying the same. There are people, and it happened in the beginning, many postgraduates and dental graduates who has gone to extremely another profession. Some have become, I heard in Bangalore, there are some science teachers who have become science teachers, and some have stepped into that medical transcription, some into the IT. See, after spending so much of money and time, and it is not 1 or 2 years, when you complete your post graduation, you only spent your 8 years of precious time in your life. So it should be worth it. Not that you should not spend, yes, but please see that you're spending worth the money which you're, because it has become very expensive. And because of this expense, even the treatment cost has gone up. It has to, no other go, it has to, because setting up a clinic itself is quite expensive and the overheads are so much. So you can't do a service. You can't do a service. I don't believe in this service giving free this thing, free that thing. No, that is not, that becomes a little different. You can do for 1 or 2, but you cannot run the whole clinic as a charity. You're not doing justice. you may be doing something wrong. Once you say free, you may not be delivering the product properly. So you need to earn also. And as I told you, oral pathology, it's a subject, very interesting subject, a detective subject. Actually, you become a detective when you see a lesion, but you can learn. Sorry to say, you can't earn now. You don't get a job. You can earn only if you get a job in a college, which I think it is going to become more and more difficult in the coming years, unless I don't know whether this the new Ayur thing which they have announced, whether that will give an opportunity for dental surgeon to get a job of teaching. I don't know who's going to teach them.
Yes.
If they are ready to have an oral pathologist, they may get so many oral pathologists to teach them. I don't know what is the government's plan, who's going to teach them, and without learning what they are going to do, I do not know.
So there has been some good movement actually. Quite a few people have been in touch with me, our youngsters, who have set up oral pathology practices and are doing quite well actually. But
It is
it
good. It
takes
is
time.
surprising.
It's taking time. And I think it is very similar to, like you say, when you started practice all those years ago and how it had to build up slowly. I think today oral pathology is in the same place that maybe dentistry was all those years ago. And it will take time till they build up their practices. But I think even a dental practice would take that time.
Yeah.
Quite a
Great
few are
things take
trying.
time.
Yes, quite a few are trying. And that is nice. And I think we can build up. But we need to build up. The thing I think we missed out was really in educating people about oral pathology.
Yes. See, that is another area where we have failed. We have to educate our own medical colleagues
First.
about this profession, about this aspect of oral pathology. See, when we studied the first year, it was a gang of about more than 200 students. You had 100 of MBBS students with that from the first year. We had about 50 pharmacology students. So the whole batch, we had an interaction with the medical students. And even after completion of the course, we were in touch with them. They were able to refer cases to us. They were learning something from us. And there were some postings for them also. They used to come to the dental wing, I think for 15 days posting or 10 days posting, and they used to spend a day in every department. I mean, I'm telling the MBBS students, in their internship, they were posted in a dental college. But I don't know whether that exists now. I do not know. And in that time, they were well educated by our own people. And we told them some importance about the oral care related to the general diseases. That is where another area which I think we have failed. Of course, we have a slide everywhere saying that mouth is the mirror of the body. But how many of us are talking about the body related to the mouth? No, I don't think even I have seen so many conferences, nobody has been addressing on that aspect. But we say mouth is the mirror. But
Yes,
how many
but the
of us are
question is,
focused?
it's a mirror. If we just say it's a mirror, what does a mirror feel or what does a mirror do? It's just a reflection.
Yeah,
You don't really
that
take care of
reflection
your
to
mirror, you take care of yourself. We're just telling people it's a mirror. So we're well and good. So they're just saying, okay, look at it. We are not going to do anything about it. So I think we need to possibly refocus that message of mouth is the mirror. I think it's a little
yes.
outdated and we need to refocus that message. Yes. So before we wind up, okay, first let
Okay.
me make an announcement. Everybody on YouTube, if you have any questions for Sir, please post it. But in the meanwhile, Sir, out of dentistry. But I think life is a very important part of what we eventually become even professionally.
Yes.
One of the things I admire about you is that I have seen your journeys alone,
Yes.
around. And what do you feel? How does the other things you do in your life, whether it is traveling alone, how do all that help to make your life more balanced so that you can deal with times when there are ups and downs professionally?
Yes, the travel has taught me so much, Mandana. The travel has, I love traveling alone. That is one thing. I love traveling alone because it gives me a lot of freedom. I just forget who I am when I'm outside India. Actually, outside, even in Chennai, if I go outside to any other state, I forget that I am an Indian, and I was able to enjoy the local food sometimes, and there was nothing which no regrets at all. But finally, I mean, back home, I love to say that India is the best.
That is true.
That I have to, because I have seen almost all the countries. And as I said, so many times, sometimes some places, even China, some 3, 4 times I have gone and seen people. But probably that is, I don't see any culture in any of these places. Whereas in India, it is, I see so many, I mean, cultural existence, which has been there for centuries, which we are still following, which I don't, it is not, it never goes out of us. I don't know how. In an Indian place, Indian house, whether it is in South India or North India, we find that the respect given to the seniors, to elders, which I don't see it in any other country. I am not seen. But it may look little odd for a Westerner to see us giving respect to our seniors, irrespective of, I mean, knowledge and other things. We respect our seniors not just because of knowledge. I mean, we respect for their experience and their age, which you learn a lot from that. It is not the subject which, subject, of course, you will be learning as you go ahead. And I think a youngster knows better than what I know. I have to accept that because they are exposed to so much. Now, I think the YouTube teaches wonderful histology and wonderful pathology. There is one person who writes a very, very good, gives us notes on general pathology. It's really very interesting, making it very simple. A good teacher is a person, not before they used to say good teacher is a person who inspires. No, that is not the good teacher. Good teacher is a person who makes it as simple as possible. That is, he is a good teacher. See, I can tell you one small experience. I had one student who was a Telugu student, and she was quite, I mean, a little dull student, not up to the mark. I was trying to explain to her the difference between a cyst and a tumor. I was, if it is a Tamil, I used to tell in Tamil and they used to understand. But this girl was a Telugu girl. So I tried her maximum and she was not able to get it at all. Finally, I asked her, Niku Tankai Telusama. I asked her, do you know coconut? In Telugu, I asked. Yes, sir, Naku Telusu, Tankai Telusu. Then I told her, do you know mangai? Mangai means mango. I told mangai Telusa. Telusu, sir. Cyst ante tangai ma, tumor ante mangai ma cheppan. And from that time, she never used to forget how the cyst and tumor. Because I think today she must be a good practitioner in Andhra Pradesh.
That's interesting.
How to make it simple, no? But now I find that most of the people are happy in making it difficult rather than simple. Some of the pathology seminars which I find, they are making it very difficult, which doesn't reach the, and you select a topic which is a rare topic, which is which is not known to anybody, and you start speaking about it. Finally, it doesn't reach the thing. It may take some years ago because there are some, sometimes it happens like that.
Yes. So we have had people with us on YouTube. Dr. Nandini says, thank you so much for sharing your enormous experience, sir. What a wonderful journey you had.
Thank
you. It was
Thank
profound.
You,
regards. And Dr. Soumya is saying, thank you. And it's all been good. So I think everyone was so involved with whatever you were saying and sharing your experiences. Nobody has written and put in any questions. They were just listening. I can understand, because when you're listening, you don't want to type.
Yeah. There is a difference between listening and hearing. I don't know how many people are listening and how many people are hearing.
Yes, there would be. Anyway, it's going to be there up for them to hear as many times as they want. It will be on YouTube.
Okay.
So it has been such a wonderful time. Like I said, I used to always really look forward, every time Rajiv Gandhi University would fail in sending me one examiner. You were my first choice. You were the first call. I would really look forward, because forget my students. I used to enjoy interacting with you, and I've learned so much from you. I always admire how you can go to the absolute basic fundamental of things, and that really makes a difference. It's a great gift that you have.
Thank you, Vandana. Thank you very much.
Something you have shared with us very kindly. So now just a second, I got to share. So you have your, I think, ex-student, Dr. Ravikant. He says, sir is an open book. And he had, in fact, told me a few days back a lot of his good experiences when he was your student. And Dr. Vanaki says, sorry he entered and late joined, but enjoyed whatever he heard. So,
okay.
Yes. So are you able to see the screen, what I'm sharing?
Yeah, I am able to see that. Yes.
Yes. So thank you so much, sir.
Thank you very much.
Great to have you here.
Thank you very much. Thank you.
Thank you, sir. Thank you, sir. Bye. Bye, sir. Have a wonderful day. Bye.
Thank you, Vandana. Thank you, everyone.
Welcome. Bye, sir. Thank you, everybody, for being with us. And I do hope you will join us again next week for another episode. Next week, we have an update. And the update is going to be on the carcinoma of unknown origin. So it is going to be quite interesting. And I hope you will be all there. And take care. Have a wonderful week. Be careful. And see you again next week.